All right, so we're going to get started on antiemetic and anti-nausea agents. Remember, when you guys print out your slides, I don't upload these in PDF format, so you can actually take these and print them or change the design to make it all white background, so it'll print out black and white, so you're not wasting ink color. Okay, antiemetic and anti-nausea agents. So what are the definitions? What's nausea? Well, it's not feeling right in your stomach, and sometimes you vomit and sometimes you don't. Vomiting, that's an emesis. So it's basically forcing gastric and intestinal contents. But antiemetics are supposed to help relieve nausea and vomiting. So what's the vomiting center? And there's the chemoreceptor trigger zone. So both of these are located in the brain, and so that is what, when you're nauseated, that trigger zone in your brain is triggered, basically. And if it's stimulated, it can cause the vomiting reflex. So again, just because you're nauseated doesn't mean that that vomiting center or the trigger zone is going to cause you to vomit, but that's exactly where it comes from. It's in the brain. What are the mechanisms of action of these medications? They usually work by blocking one of the vomiting pathways, so that's why there's different alternatives and different choices, as well as like old medications, and then we've become better at finding medications that work better for nausea. And so what it does is it blocks a stimulus that induces the vomiting in that pathway. So what are they for? They prevent and reduce nausea and vomiting. All right, so let's start with anticholinergic agents. I know you guys have heard a lot about anticholinergics, and now you're probably learning that they're used for a variety of things. Well, this one in particular is called a scopolamine patch. It's called an acetylcholine receptor. You have an acetylcholine receptor in the inner ear. This is also working on the vomiting center in your brain. So what you do with the scopolamine patch, you put it behind your ear, and it stays on for 3 days, 72 hours. Then you can take it off and replace it or be done with it. Remember, with anticholinergics, it can cause dry mouth, constipation. When it's put behind the ear, it doesn't become absorbed in the inner ear. It becomes absorbed systemically. That's just the best place that has been indicated to put it. So just remember that it's not going in the inner ear. It's actually working systemically to help that, vomiting center, to help block the pathway there. It's used for motion sickness, like if you're going on a cruise. A lot of people have those patches behind their ears, or airplane rides. If you get sick, car sick, sometimes you can use those if it's a bad enough car sickness. Then we have antihistamine agents. These are your Benadryl, your Antivert, which is meclizine, and Phenergan promethazine. So these are used commonly. Remember the H1 receptor blockers? So we talked a lot about Benadryl, a little bit about the promethazine. Remember with the IV, how it can cause an ulcer, or from extravasation of the IV, you need a large bore needle, but they're anti-nausea medications. So H1 receptor blockers, they bind this acetylcholine, inhibits the acetylcholine by binding to the H1 receptors. So it prevents the cholinergic stimulation in the vestibular, inner ear, reticular areas, thus preventing nausea, vomiting. So in a roundabout way, it's basically hitting another pathway with the vomiting center and the chemoreceptor trigger zone. It's used also for coughs, allergy symptoms, and sedation. All right, so we have Benadryl, Antivert, promethazine, which is your Phenergan. I would know the generics: diphenhydramine, meclizine, and promethazine. If it's on a test, I always make sure that both of them are on there, like promethazine and then Phenergan in parentheses. So let's not forget about the Phenergan, to make sure it's given through a large bore needle because of the tissue necrosis or abscess. You need to make sure you're checking the IV site frequently to make sure that it's still patent and it has not blown. And the way that you give the Phenergan is, don't give it over a long time. It doesn't really make any difference, but it's usually just given more rapidly. Now we have some prokinetic agents. These are your compazine, your prochlorperazine, and your chlorpromazine. It's Thorazine. Thorazine, these can be used for psychiatric disorders, especially the Thorazine. You'll see that a lot with schizophrenics. It blocks dopamine receptors, and so a lot of times it can work with psychotic disorders also. It's given for intractable hiccups that don't go away, but compazine was actually one of the few drugs that were out years ago, back in the 90s. So compazine was prescribed a lot. Now it's more, you see Zofran, which we'll talk about in a little bit. But this was pretty much the only thing around. So compazine does work very well, but again, it can cause side effects. You can get those extrapyramidal side effects. You can get these weird twitching. It's rare, but once you see a compazine reaction, you won't forget it. So these block dopamine. Okay, so prokinetic agents, let's break this down. We got the neuroleptic agents, which block the dopamine receptors. We also have the prokinetic agents that block dopamine, stimulate peristalsis in the GI tract, enhance emptying of the stomach contents. This is Regulin, metoclopramide. So that's Regulin. Regulin is given for people with diabetes that have gastroparesis because basically the food's just sitting there. So it stimulates peristalsis in that GI tract. It's used for GERD, delayed gastric emptying, which I just mentioned. Now we have serotonin blockers, which are your Antiemetics, which is rarely given anymore. I just remember giving that a lot in recovery room back in the 90s. Kytril, which I've never given, and then Zofran is always given. It blocks the serotonin receptors in the GI tract and your chemoreceptor trigger zone in the vomiting center. It's used for nausea and vomiting. It's good for those with chemotherapy and post-op nausea and vomiting. And then we have our THC, which is the major psychoactive substance in marijuana. Not that I'm recommending it. It's not legal yet in Wisconsin. Although I always say, you know, I think that it should become legal. I know there's some adverse effects of having it become legal, but my answer is we can pay off taxes, and people will go towards marijuana versus becoming addicted to the opioids. And actually, marijuana has become really more of a common household name, it seems. I work in Racine, and we do drug screens on everybody for their pre-op surgery, and I would say 80 to 90% of them are positive for marijuana. And when I tell them, they say, yeah, I use it for pain. So whether it's an excuse or not, it's just more mainstay. I'm not saying I promote it. I don't smoke marijuana, so don't get that. But I think that there are some benefits, or a lot of benefits, and it really is beneficial for many things, but including nausea, an anti-nausea effect. Marinol is one of them, and I believe and this is approved in Wisconsin. Because I've given it before to people that have had chronic pain issues, people that have had cancer, you know, that is for a long time with pain. AIDS patients can take it, and it's really helpful for that. So I know we talked about Zofran. It works on the serotonin receptors. It's a selective T3, so I know we talked about being a serotonin blocker, but it's very specific, and that's why it's used so well, because it's worked very well with cancer chemotherapy. Can be used safely in pregnancy, so remember that. And remember, some common side effects are headache and dizziness. It doesn't mean that they have to stop taking it. They should just keep taking it if tolerated. But remember, in pregnancy, you probably don't want to take anything if you don't need to. Some people that have intractable vomiting, obviously you probably need to go on the Zofran. but you want to try non-pharmacologic agents first. The most important thing is to tell them to avoid spicy and fatty foods. For some reason, that seems to be a trigger with pregnancy nausea. And remember that morning sickness doesn't mean it's just in the morning. It can be all day long. What are side effects? Well, it just depends, which we talked about some of the side effects going through them. And again, you're getting your history, you're looking at their other medications, and make sure there's nothing interacting with the medications. These can cause severe drowsiness. The severe drowsiness are more so with your H1, those histamines like your Phenergan, your Phenergan and your Benadryl. You have to be careful with taking with alcohol because remember it's working with the central nervous system. It can depress it. And sometimes some of these can cause some hypotensive effects. You don't need to know like specific ones cause what, but just kind of remember like if you're using Benadryl versus any of the other ones where it's working in your body. Usually antiemetics are given 1/2 to 3 hours before chemo because you want it to start working and be well working in your body before you start the chemo. And you're obviously going to ask to see if it's working, if they're having any adverse effects. All right, that's it on this one.